Welcome back to my channel. I'm Ebony, owner of Lux Wellness, where I provide mental wellness coaching, helping you to prioritize and nurture your mental and emotional wellness while also elevating your everyday live lifestyle with the goal of recreating a happier and healthier you. If you are looking for a place to belong, go ahead and hit that subscribe button because we want you to come with what you have as you are, with the goal of working on yourself and learning how to do the work internally and externally. Now let's go ahead and get into today's video. So I know that I've been MIA on my social media platforms for some time, and I want to talk about where I've been and the why, with the hopes that this will educate and inspire you to listen to your body and determine what next steps you need to take in order to increase your quality of life, your health, and your mental health. Prior to 2024, I was advised by a medical provider that I did have 2 small fibroids, and I was told at that time there was nothing to do and that it was probably more of a risk to remove them because of their sizing and location, and that they were not causing me any issues at that time. I did go and get a second opinion from another GYN provider, and I also kept my primary care doctor in the loop because my mom had a history of fibroids and I know other women who have encountered these issues. So I did go and follow up with another provider because I was aware of the history of fibroids, the symptoms that they can bring, and how they can impact your health, because my mom experienced fibroids early on in her life, and I know a plethora of other women who have gone through this challenge. And so I thought that I was being preventative and I wanted an intervention, and I wanted to hear from an expert, and I was told again and denied surgery to remove the fibroids, and was advised that they're not causing me any issues at the time and that it would probably be more of a risk to remove them. And then 2024 hits and my mom's diagnosed with cancer. She became my priority while I still, managed to take care of myself, managed 2 businesses, managed my home, continue to show up the best that I could in my marriage, continue to show up as the best friend that I could, and to show up in every other area of my life the best that I could offer. Mid 2024, I noticed an increase of my cycle. I noticed an increase of fatigue. I noticed that I started having a lot of onsets of shortness of breath, bone pain. And I know at my big age, some people probably would think, well, that's normal, but I knew that there was something underlying going on. I did not think that it was related to the fibroids. I did think and know that the increase of the menstrual cycle was, but I'm talking about the onset of the other symptoms. I did not relate that to fibroids. And so I continued to show up in the best that I could in every area of my life. And I am so blessed to have had that opportunity to not only take care of my mom during that journey, to nurture her, to love on her, and to be her voice, during that time as it relates to her health, but to also just get that moment to spend all of those extra tender days with her until her transition. And in the midst of that, I just started to feel unwell. At some point, I did associate some of those symptoms of feeling overstimulated and overwhelmed to just being tired emotionally and physically. And I did associate it with an early onset of grief, because the truth is, when you are aware of what the journey is leading to when you're taking care of a ill loved one, you start to grieve them before they even transition. And I know that was my case. And I know that with that, I dealt with so many different emotions on a day-to-day basis, but I still continue to show up in the best version of myself that I could in my life and her life. And let me just say, I am a person who am very engaged with my care. I'm very in tune to my body. I am very adherent to my medical appointments, meaning that I do my annual health screenings. If there are any follow-up appointments that I'm advised to do, I follow up on my follow-up appointments. I am the person that sits down, and when I do my annual labs, I need to be explained what my labs represent. Don't just tell me everything's fine and everything's normal. I'm not that person, and I encourage you all to not be that person either, which is one of the reasons why I'm really doing this video, because my goal is to help you to learn how to advocate for yourself as it relates to your health care, and in situations where your symptoms may be dismissed and or you're not given an explanation as to what's truly going on with your health care. Now, for those of you that are adherent with your health care and you're going to your annual visits and you are just told, oh, everything's fine, everything's normal, you need to ask a little bit more questions. What is normal? Because normal can mean a lot of things. even though there may be something underlying going on with your health. Normal may not mean anything to you if your body is still experiencing certain symptoms, okay? So with the experience that I have with 11 plus years in medical care and being aware of certain women's health problems because of my profession, I knew that there was something underlying going on. And after numerous urgent care visits with shortness of breath and feeling off, some days it was just general malaise. Like I didn't really have a way to explain what I was feeling. I mean, just feeling very off, heart palpitations, and just feeling different on the stomach with no associated symptoms that should be related to me feeling this way, and just consistently being told it's anxiety. Now, as someone who has a background in mental health therapy and behavior management, while those symptoms may have looked close to anxiety, I knew that I was not suffering from anxiety, because while my life was not in a perfect stand at that time, there also was nothing that was causing me to be anxious. And I say that, and I know some of you are probably thinking like, what? You were in the midst of taking care of your mom and she was preparing to depart. What I had to say about that is, and I won't get into too much of that in today's video because this is not the purpose of today's video, but me and my mom had a very, very open communication prior to her diagnosis and during her diagnosis. So we had those sensitive conversations that provided me the level of comfort that I needed in that season. So I wasn't anxious. I wasn't overwhelmed. I wasn't overstimulated. If anything, I can say that there was an onset of sadness that I kind of had to carry, because one of the things I didn't want to do was pour my grief on her. I wanted her to know that I was there to carry her. I was there to carry her weight. I was there to carry her emotions. I was there to carry anything that she needed in that season of her life. And we did that. So we had open conversations. There was nothing for me to be anxious about. I had all the resources that I need. I had all the backing that I need. My parents were very stable, so there was no issues with challenges with getting her the medical care that she needed. Only thing that I could think of was that my body was changing due to an underlying issue, and I could not put my hand on that issue. I went back to the drawing board and I had another conversation with my doctors, and I did not get the response that I thought that I deserved and that I needed. I didn't feel seen and heard, and so I made the decision to go ahead, do my own research, and get myself into care with another set of providers from a primary care perspective and a GYN perspective. And that's one of the things I want to encourage you. If you are with medical doctors right now and you're consistently reporting the same symptoms and you're not getting any response or any help or any next steps, and or they're not even able to explain to you what you may be experiencing, it's probably time for you to do your own research, identify and schedule a consultation with other providers that may be able to provide you a little bit more in-depth either education, screening, or testing based on what your insurance will cover, and or to give you a little bit more of attention to your symptoms, because apparently you are the expert of your body. You know your body better than anybody, and no one should be dismissing your symptoms, especially where there can be an underlying issue that could severely cause you your life and or increase and or modify into another level of a chronic illness. And I'm happy to say, based on my research, I got with a group of excellent providers, and within 2 weeks I was scheduled for surgery based on my labs. And if I can tell you how detrimental this was, by the time I got into care with the new providers, my ferritin was a 3. So those of you that are not familiar with ferritin and how it relates to iron levels, ferritin is where your iron is stored. Think of it like the house. Okay, that's the house where your iron lives. And so my iron was low. I was actually diagnosed with anemia at that time, and my ferritin was a 3. Okay, a 3. Okay, the last ER visit that I had due to shortness of breath was an eye-opener for me, because the physician actually said, I don't know how you're walking around right now. You know, your levels are severely low. From that, we went on and we moved forward, because now it's time to do something. And I was very direct in what I needed, what I required. So I had to advocate for myself, because I was not going to go to any more visits and be scheduled for follow-ups. I had tried iron supplements by mouth, the pill form. They did not do well with me. I did not respond well to them. We did try to do iron infusions, which is when they give you the iron through the IV. And so I was adherent. I was ready to try anything. I did not respond well to the iron infusions. It had nothing to do with the provider. My body just did not respond well to the iron infusions. And actually during my treatment, I experienced a onset of rashes, issues with breathing. It was not a good experience. And I'm not putting this information out there to scare you, because you may not have this same experience. You may not be prescribed the iron treatment that I was prescribed, but I'm just speaking from my personal experience and what led to the end result and what the time lapse looked like for me. Now, I'm not sharing this information to create any fear in you. I'm just totally speaking from my personal experience so that I can give you all a clear picture of the time lapse in between my care. And you may not have this experience. You may tolerate iron infusions very well. So the treatments did work. My levels did come up to what was stable. And within 2 weeks with my new GYN, I was scheduled to go in and do a myomectomy hysteroscopic procedure. And the fibroids were successfully removed. Recovery was a success. I had the support that I needed. During that moment, when I was first scheduled for surgery, it was a lot of thoughts running through my head. It was the fear of the surgery, and more so, I had never done anything medically in my life without my mom. So it was such a different transition for me, and it's such a different experience. But I must say that, and having the support in my home, things went smooth and everything went well. And I was able to really take some time to really nurture myself mentally and think about not only what I've been through and how I had to fight through those days of severe fatigue, not able to get out of the bed, wanting to get out of the bed, but my body just couldn't do it. Dealing with the heavy menstrual cycles, dealing with the emotions that were modified from day to day because out of frustration of wanting answers and wanting to feel like myself again, on top of navigating grief. That was rough. And I must sit here and say that if you're someone right now, when you feel frustrated because you feel like your symptoms are not being seen and heard, and or you are someone that's struggling and or navigating with a chronic illness right now, there are options for you to enhance your quality of life regardless of what season you are in with your health care. You just got to find what works for you. You have to ask the right questions. I know that one of the biggest things we say is that you have to have a support system, but that's not the case for everybody. A lot of people don't have an extreme amount of support, and or you may be living alone. So you got to find what works for you, and you got to recreate your own calm in this season of your life. And I think that's very important, which is one of the reasons why I'm always stressing and talking about developing and creating your home to be a therapeutic home, because regardless of where you go in your life and your day, you always come back home. You always end up back home. When you go to work and you have a hard day, you come back home. When you go to work or you go out in the community or you're out socializing or you're out with friends and family, you come back home. Your home needs to be able to provide you that comfort and calmness that you need so that you can sincerely work on yourself mentally and emotionally. Because I'm telling you, the one place that you're going to be 100% honest with yourself when it comes to mental and emotional challenges, regardless of what you're going through, it's home. You're always going to find home to be that one place that you can be honest and open with yourself. And I think that's the starting point of you working on yourself. So if you are someone who has been challenged with an increase of menstrual cycles, your cravings have changed. My cravings were through the roof, not only with the ice, which was a big significant factor of when I knew that something was severely wrong, because it was like I needed the ice to function. Me and my mom would be going to chemotherapy. Now I had the biggest jug of ice. I would sit it right in her lap in her wheelchair. And I'm like, girl, hold this. Don't drop that. Whatever you do today, don't drop that ice. That's how severe it was. And I would have my peppers and olives in my purse. I was literally walking around work, appointments everywhere with olives and peppers in my purse because my body was craving the sodium. My body was truly in survival mode and trying its best to keep going. So I'm just happy that I did not stop advocating for myself. I was a little upset that I was dismissed prior to when I wanted to have the fibroid surgically removed prior to, because I know that that would have prevented all of these things from happening. However, we can't go back. We're going to go forward. I want to encourage you, if you are experiencing an increase of your menstrual cycles, your cravings are through the roof and they're changing, you're finding yourself needing more ice and or other cravings that you know you usually don't have, you're starting to have loss of your hair, your skin is changing, and you're starting to have bone issues, insomnia, migraines was a big thing for me. I had migraines so consistently, but the funny part is that I've always suffered with headaches since I was younger. So again, I did not associate that with low iron, but I knew that something was wrong because it was the change in the consistency of the migraines. Don't stop until you get a provider that's going to hear you. Don't get intimidated by the healthcare system. Don't get intimidated by the doctors that you're going to speak to, because I'm telling you, there is going to be one provider that is going to take you in. They're going to understand what you're saying, but in order to understand you, they got to hear you, and they gotta really take in what you're saying as an effort to create an accurate treatment plan for you. Sometimes there has to be a little bit more in-depth testing and screenings done, because the body is funny. I know sometimes we want answers right away, but you may not get the answers right away. But if you get a team of providers that's willing to hear you out, work with you, and take you on this journey of really digging into your symptoms, you will get to the bottom line of your issues. And if you have to make a decision as to what your next steps are, if you are someone that are experiencing challenges related to your fibroids, you make the best decision for you. I was given every option possible. I was highly educated as to what options were available to me. In this season of my life, I decided not to get a hysterectomy, and my doctor supported my decision. And so there you have it. Now, I don't know what the future will hold, because I do understand that fibroids can return, and we're going to have to just see what happens from here on out. But I must say, I feel so much better. I do still struggle with fatigue a little bit, and right now, I'm trying a new treatment system, and we're going to see how that goes to see if this makes a change. Also, I noticed that my blood pressure started to increase during this journey. While I have not been diagnosed with hypertension just yet, I have been given something as a treatment, because again, there were so many things going on at one time when all of these medical symptoms increased. This could be situational, and or we gonna have to do a little bit more investigating, and time will tell what my future healthcare looks like. So I'm hoping that this video inspired you, and it encouraged you to nurture yourself and take a look at what your symptoms are right now in your current season, and to become comfortable with talking about these things, because you are not the only one going through them, and there are treatments that are available for you. You just got to go and get with the right provider that's going to give you your options, and you have to develop some level of faith and trust to know if it's time for you to take a next step in an effort to enhance your quality of life as it relates to your symptoms. And do your research, read up on things. I am very big on taking on information from experts in their fields, but I'm also one of the people that I have to do my own research, and I read, and I need a different level of understanding before I make any decisions, because I need to make sure that I'm making the best decision for me, not based on anything that anyone has told me, not based on any education that comes from any content that I've received, because all of our bodies are different. All of us are going through different things, even though they may be due to similar situations. So your homework for this week is to start creating a log. I want you to create a log, and you're going to document your symptoms. You're going to document all your symptoms, from your mental symptoms to your physical symptoms. You're going to start to track your period. You're going to even talk about how many times you've had to change your pads during your cycle, because this gives a good idea as to your blood loss, how heavy your symptoms are increasing over time. If you want to go a step further, I would encourage you to also do a mood tracker. You want to identify how your mood is changing, how your sleep is changing, if any. And you want to also take a look at that external part of yourself and document those symptoms as well. Are you losing hair? Have you noticed that you're having more dry skin? Are there any breakouts? Are you having any issues? Are you taking any supplement? You want to give a overall overview when you go in and have your consultation. You want to go in with something. You can't go in with anything and expecting a provider to miraculously diagnose you and or know what you're going through, because you are the expert of your body. So I want you to go in and uphold yourself in the standard that you are the expert and that you are there to now start your healthcare journey in the most desirable way, because you deserve to live a high quality life. You deserve to feel better. Although this whole situation with women suffering from fibroids is detrimental and it's becoming more common than we know. The numbers have increased over time, and there are a lot of conversations being had with healthcare providers, and there are some treatments that can possibly help you to enhance your quality of life. I hope that this helps somebody. I hope that you feel inspired. I feel like if my story can help one person feel encouraged and inspired to go and start their healthcare journey and or take their symptoms serious and not dismiss them and not ignore them themselves, because I never ignored the symptoms. It was timeline, trying treatments that did not help me, and then having an increase of symptoms, and then me finding a new set of providers that were willing now to hear me out, to say, hey, this is what I got going on. This is what I'm looking for. This is what I need. And this is not anxiety. This is not what I'm being told that it is. As someone who has a high level of understanding of anxiety, I was very much aware that that was not what it is. And I know I have met a few women on social media who have shared with me. I shared this content over on Instagram and TikTok, and they have shared with me prior to that, oh, I went in for these symptoms, but I'm being told that everything's fine. And I'm told that it's just anxiety, and they sent me home with a script for anxiety medication, but I still feel unwell. And so I have to say to you, you have to know when your limits are up. You have to know when you have to advocate for yourself and ask for more help. There's nothing wrong with you asking for more help. Again, you just got to get with the right providers, and you got to find what's going to work for you. And you got to find what coping skills are going to help you through this season, because I'm not going to tell you that this did not have an impact on me emotionally, because it did, on top of grief. But I know there's so many of you that are managing so many things in life. You may not be encountering grief, but you're probably managing medical symptoms on top of single parenting, trying to hold a household together, trying to find a job, trying to get through school, caring for a loved one, caring for yourself, marriage, divorce, whatever your case may be. I know that all of us are carrying the weight of multiple things. And guess what? You're going to be all right. You just got to now make the next move and determine how you're going to take control over your own health care. I'll see y'all in the next one. Let me know down in the comments if you experienced any of these issues related to fibroids, anemia, or low ferritin. What helped you? And let's make sure that we're encouraging our sisters in the comments. I'll see y'all in the next one.